I'm Dr. Lance Klingler. I've been with Concord Orthopedics. This is the middle of my 11th year. I came to Concord Orthopedics after my hand fellowship at Brown, and prior to that I was in medical school in Nashville, Tennessee at Vanderbilt, and did my orthopedic residency in Illinois. I first was exposed to New England in college, where I went to Middlebury College and met my wife, who's from New England. I think I wanted to become a doctor. Everyone typically has an experience like this. I broke my arm playing baseball, sliding into second base. I broke both bones of my forearm and spent some time in casts and got out of my cast, and 3 days later broke the same break again and went back into a cast for 8 weeks. And I spent a lot of time with orthopedic surgeons, and that was just sort of my personal portal into medicine. My father's a doctor, but he's a dermatologist, and I did not share his interest in looking at skin all day long. I was more interested in hurt people than sick people, and so I just sort of funneled my way into orthopedics. Hurt people have a problem, and you can fix their problem and make them better. And so to me, just to how my mind works, it's just different than having a longitudinal relationship if you're a primary care doctor who's taking care of somebody's diabetes or other problems for years and years and years and years, where the problem never necessarily gets fixed. It just gets managed. And I like to fix things. I chose hand surgery because of the variability in hand surgery. We take care of the entire spectrum, from a newborn baby with 6 fingers to an elderly patient who falls out of bed in a nursing home and has a badly broken wrist that needs to be fixed just for pain. And so I get to do lots of different things: bone work, arthritis work, tendon injuries, cut nerves, nerve grafting, skin grafting. And so there's a huge spectrum of what I get to take care of. And so there's day-to-day variance, be it in the office, who you're seeing next for your patient, and there's case-to-case variance when you're working in surgery and what you're doing next. It could be that your first case of the day could be a 2-year-old who has 2 fingers that never separated when they were in utero, and you have to separate their fingers, up to 52-year-old lady with carpal tunnel who can't sleep at night because she's waking up with numb hands all the time. And it's a great way to just have a lot of variability in your job with multiple different ways to help people. And in terms of my personal philosophy of practicing medicine, it's simple. I want to treat every person like they're my family member. If you were my brother, would I do this operation? If you were my daughter, would I let you ski in this cast? If you were my mom, is it time to fix your thumb? That's the way I practice. I like to be outside. I work inside, oftentimes not seeing the sun, for a given day on end when it's New Hampshire in December and we get to work at 6:30 and leave at 5. I like to be outside. I like to ski. I like to hike. I like to fish.